Well, after hearing everyone's discussion, it's clear to me that some of you do have a good idea about what cardiac risk factors are and what preventions to take for them, but there is still quite a few of you out there who don't really know much about them. So this next part of the lecture is going to deal with talking about different types of cardiac risk factors and explain them in more detail. So there's two different types of cardiac risk factors out there. There's non-modifiable, which means that you can't change them, and these include gender, age, and heredity. And there's also modifiable risk factors, which include hypertension, high cholesterol, smoking, obesity, impaired fasting blood glucose or diabetes, also sedentary lifestyle, which just means physical inactivity, and also stress and behavior. And all of these that I just listed you can change. So first off, with some of the non-modifiable risk factors, gender and age. For men that are older than the age of 45, there's a greater chance of heart disease, and also women who are age 55 or older have an increased risk. Also, males have this higher incidence at a younger age. However, once women become postmenopausal, then the age differences become about the same, and the incidence rate is about the same for male and females. For hereditary, if your father or your brother had a heart attack before the age of 55, this is considered a positive risk factor for heart disease. And if your mother or sister had a heart attack or stroke or something like that before the age of 65, then it's also considered a positive risk factor. With the first non-modifiable risk factor I'm going to talk about is hypertension, and this also means high blood pressure, of course, for those of you who didn't know. And what you want your blood pressure to be around is 120/80, and if it is over 140/90, then this is considered a positive risk factor and you are at an increased risk for heart disease. High cholesterol is the next non-modifiable risk factor, and you want your optimal levels for normal to be total cholesterol below 160. You want your LDL cholesterol, which is your bad cholesterol, to be below 100, and you would like your HDL cholesterol to be greater than 40. Now, for it to be a positive risk factor, you don't want your total cholesterol to be over 200. You don't want your LDL, which is your bad cholesterol again, to be over 130, and you want to have good HDL cholesterol, and if you have that above 60, it'll actually wipe away one of your other positive risk factors. So let's say you have hypertension, but you have HDL cholesterol that's greater than 60, wipes the slate clean. Now the next non-modifiable risk factor is smoking, and with smoking, if you quit in the last 6 months or are currently still a smoker, then this is considered a positive risk factor and you're at an increased risk for heart disease. And it is worth quitting, because once you quit, you add 5 to 7 years to your lifespan if you quit after the age of 60. So that's a pretty good amount of years there. With obesity, you can calculate this a few different ways. The way I like is through BMI, or body mass index, and that's just your height in meters divided by your weight in kilograms squared, and this will give you a number. And if that number is greater than 30, you are considered obese, and that is a positive risk factor for heart disease. And if you're under 25, that's considered normal. And you also don't want to be less than 19, because that's way too thin. Now the next segment here for non-modifiable risk factors is sedentary lifestyle, which also means physical inactivity. And what you want to have is about 30 minutes each day of moderate intensity exercise, which is like jogging, like that. So, and you want to do it about 3 to 5 days a week. And if you don't do it that much, it's considered a positive risk factor, and then once again you are at an increased risk for heart disease. And now research is showing that you want to exercise most days of the week, so 5 to 7 even. So get out there and exercise, folks. The next non-modifiable risk factor that you can't change, or that you can change, or modifiable risk factor rather, is impaired fasting blood glucose. And this goes along with diabetes. Optimal levels for this are below 100, and if you are greater than 125, you are considered diabetic, and this is a positive risk factor for heart disease. Also, the last modifiable risk factor that you can change is stress and behavior. New research suggests that people with high levels of stress have higher blood pressure, and once again, high blood pressure is a positive risk factor for heart disease. So it's a good reason to find ways to cope with your stress. And also, consumption of alcohol can also be a risk factor for heart disease. And guidelines on this: men should have no more than 2 drinks per day, and females should have no more than 1 drink per day. And this also doesn't mean building up your drinks so that on Friday night you can go out and party. It doesn't work like that. So those are all of the risk factors now, and we're going to move on from here to another activity where we're going to brainstorm what you guys can do to help prevent these modifiable risk factors.